The Hormonal Implant, a presentation by Lisa Crowley. Before going into what the hormonal implant is, we must first understand what contraception is. Contraception is a category in birth control in which the sperm and egg are prevented from uniting. It includes barrier methods, spermicides, hormonal methods, and intrauterine contraceptives. The implant falls under the hormonal method. The implanon, also known as the implant, is a thin, flexible plastic rod about the size of a cardboard matchstick that is inserted under the skin of the upper arm and protects against pregnancy for up to 3 years. It releases the hormone progestin, which prevents ovaries from releasing eggs and thickens cervical mucus to block sperm. When getting the hormonal implant inserted, first you must have your medical history taken. Then you are given a physical exam. A small area of your arm is numbed with a painkiller. It is then inserted under the skin. This only takes a few minutes. It should be removed right after 3 years so that it does not interfere with your period. However, it can be removed any time before then. When being removed, they numb your arm again with a painkiller. They make one small cut to remove the implant, and it takes just a little bit longer than it did when you had it inserted. A new implant can be inserted at that time, but be warned, pregnancy can happen any time after the implant is removed. The hormonal implant is very successful. Less than 1 in 100 women a year will become pregnant, and it lasts for 3 years. However, there are certain medicines and supplements that make it less effective. These include certain TB medicines, certain medicines taken by mouth for yeast infections, certain HIV medicines, certain anti-seizure medicines, certain mental disorder medicines, and herbals like St. John's wort. Also, this should not be used if you are pregnant or have breast cancer. The cost for the exam, the implant, and the insertion can range from $0 to $800. For removal, it can range from $0 to $300. There are many advantages to using the hormonal implant. These include that it is highly effective, easy to insert, discreet, does not interrupt sex or require maintenance, has no estrogen-related side effects. It is easily reversible and may provide relief or pelvic pain due to endometriosis or other causes. It also gives you the ability to become pregnant quickly when you stop using the implant. It can be used while breastfeeding. It also can be used by women who cannot take estrogen. It gives continuous, long-lasting birth control without sterilization. There is no medicine to take every day, and many women adjust to it with few or no problems. There are disadvantages to using the hormonal implant, but they are very rare in most women. They include may cause unpredictable bleeding and weight gain, may have insertion complications, and may increase risk of blood clots. There may be a change in sex drive, discoloring or scarring of the skin over the implant, headaches, rarely an infection or a pain in the arm, nausea, pain at the insertion site, sore breasts. Also, it is clinician dependent, so once inserted, women have little control over their contraceptive choices. The most important disadvantage of using the hormonal implant is that it does not prevent from STDs, so using a condom is still highly recommended. The most common side effect is that it has a big effect on our menstrual cycle. This includes irregular bleeding, and for most women, periods become fewer and lighter. After 1 year, 1/3 of women who use the birth control implant will stop having periods completely. However, some women will have longer and heavier periods, and some women will have increased spotting and lighter bleeding between periods.